A major health alert. This season's deadly flu outbreak could be the worst in nearly a decade. Almost the entire country now under a high warning level, and it's not showing any signs of slowing down. Fox News' medical A team, Dr. Marc Siegel, joins us now with exactly how worried we should be. Thank you very much for joining us this morning, first of all. So I understand, hospitals are even having to bring in extra beds to deal with all the patients that they're dealing with.
We may see over 500,000 hospitalizations this flu season. We may see over 50,000 deaths. That's what Centers for Disease Control reports on particularly bad seasons. It's never really in a long time ever been this widespread this early, and now it's coming to the heart of the flu season. We still have a couple of months left, probably.
Let's take a look at some of the statistics. 1 in 10 deaths in America are caused by the flu. 63 pediatric deaths from the flu this season so far.
Now, when you say deaths are caused by, I want to add that the flu is an enabler. Not only can it storm your immune system and lead to tragic deaths where you're not predicting it, but it also can come along and bring in pneumonia with it or another bacterial infection. So we physicians that treat the flu have to be on the lookout for that. And sometimes as we're giving an antiviral drug, we also have to give an antibiotic.
Yeah, I went and got the flu shot on Thursday of last week, and I got one of the last 2 that they had left. So they're running out of flu shots as well, and they told me that they're also running out of medication to treat the flu.
Absolutely. Now, in terms of the flu shot, it takes about 2 weeks for it to work. It's a particularly good time to get the flu shot because the main strain we've been talking about, H3N2, that strain, the most severe, is not as well covered by the flu shot as the other 3 strains that are starting to surface now. So the flu shot that you just had is going to protect you towards the latter part of the flu season when there's better protection from the shot. And the antiviral drugs, I think, are underused. I think they should be used when people are particularly at risk for complications.
Yeah, a friend of mine, I've mentioned this before, she died of the flu. She had 2 little children, 38 years old, healthy, was trying to treat herself and, died from the flu, which is amazing to me. Why is it so bad this season?
By the way, physicians have to be in the loop. So I would say, for anyone out there who hears this story, make sure your doctor knows about your symptoms because they may or may not be the flu. This is a particularly bad season because of this strain, this type of influenza A. And influenza A starts in birds. These are more severe. This strain is one that we don't have a lot of immunity to, and that's why it's causing all the problems. We talk about pandemic years, Heather, but this particular strain, even if we've seen it before, is a little different, and it's just different enough.
Let's switch to something else that's causing a lot of deaths, the opioid use. We have about a minute left. This company they're caving to pressure. They're not going to market opioids to doctors anymore.
Well, and so they're cutting down their sales force from 200 to 100 and not going to be marketing opioids. But look, 7 million Americans have already used OxyContin. OxyContin was marketed 2 decades ago as causing smooth and sustained pain relief all day and night. It didn't work that well. It was a false claim. They're being sued all over the place by states, by cities, by counties. Now, I don't actually blame the pharmaceutical companies as much as I blame the physicians. Both bear blame, but doctors actually write the prescriptions. But this particular company and other companies were busy plying us and saying, look, don't worry about it. No side effects will cure the problem. That's false advertising, and that's why they're under the gun.
Yeah,
and they should be.
It's a big problem. What U.S. deaths linked to opioids have quadrupled since 2000.
And you know what? Areas where OxyContin is prescribed are the same areas where you're seeing all the heroin overdose deaths. So there's a link. You get used to a prescription drug, and the next thing you know, you can't get it, you get an illicit drug.
All right. You know about everything. Dr. Marc Siegel joining us. Thank you so much.
Thank you,
appreciate it this morning.
Good to see you.